Every month we have some pretty devastating workers' comp injuries. Some are minor, some are pretty severe. Either way, we have to do something different, you guys. The way I see it, nurses and nursing assistants are some of our most valuable resources. If you aren't here, there's no one to give care. 3 out of 4 nurses will spend at least 50% of their time doing repetitive activities like lifting, pulling, pushing, twisting. Just take a look at what we learned from the auto industry. If you just lift 30 pounds repetitively over the course of X amount of years, you will have back injuries. It's all cumulative. Body mechanics are very important, and I'm going to show you some body mechanics, but you also have to consider ergonomics. For example, maybe the bed that you're repositioning the patient on does not raise to the proper height. Perhaps you need to give a resident a shower and you don't properly fit in the shower with the resident, so you have to kind of turn your body, contort your body in order to make it work. But lifting is by far the most dangerous thing you could do. Just consider this. If a nurse lifts a patient every 15 minutes during an 8-hour shift, and the weight of that patient is just a simple 150 pounds, the nurse would end up lifting over 4,000 pounds or over 2 tons during the course of the shift. Now, why aren't we all ripped then? Well, it's lower amounts of weight, and it's over the course of several days, months, or years, but we're still doing damage. So we need to work on avoiding heavy movements and awkward positions. Sometimes we're required to lift, pull, or twist simultaneously, so not just one, but several at a time. Some of the most dangerous things that we could do are picking up legs, pulling someone from the bed over to a stretcher, because then you have to lean really, really far. Or worse yet, let's say you're not using a gait belt to lift a resident, and instead you tell the resident to give you a hug around the neck. You're probably bending over at a 90-degree angle and you're working to pick the resident up. It's just really bad. The things that you do now may be painless, but like I said, it's cumulative. It builds up over time. Some of the things that nurses complain the most about are low back injuries, shoulder injuries, wrist and hand injuries, and lower extremity injuries. I, for one, can think of a person that has had each one of those within the last few years, and it's really, really sad. In 2001, there was a study done by the American Nurses Association. They had surveyed 5,000 nurses, so you know this was a pretty decent sample. And 83% of those nurses had experienced back pain or consider ongoing back pain. It could be acute, it could be chronic, it may have been there for a while and went away. Basically, back pain existed. And honestly, I think we as nurses know what we're doing, but the problem is that we're not getting help. We're not utilizing our teammates appropriately. Maybe we're short-staffed, so we have to take shortcuts. I know what that's like. I've been there. I've done that. The lowest back, the lowest part of your body is your back, and that is at the highest risk for injury. And that also has the highest risk for structural damage. The reason that we get stiff at the end of the day is because we have inflammation. We have increase in blood flow to that area. And eventually that part of your back will scar. There'll be stenosis, there'll be structural damages. At that point, you may need surgery. Like I said before, probably for the 3rd time now, it's cumulative damage. One thing I didn't know that I thought was interesting is that the nucleus of the spinal disc does not contain nociceptors or pain receptors. So you may be completely unaware that you're damaging your back until that one day when you do it wrong for the last time and you hear that pop and you experience that excruciating pain. The damage has already been done, guys. We have to be so careful. And then look at your shoulder. This is the most movable joint in the body. So as you can imagine, if you do something wrong, it's most prone to injury. That's why we end up with rotator cuff injuries that are so difficult to heal. When I worked at Mayo Clinic Rochester, we were not allowed to use our back for anything. We were a 100% lift policy facility. We had a ceiling lift in every room. Now that would cost about $25,000 a pop, so we don't have that where we're at, but it just goes to show the extremes that some employers go to make sure that you guys stay safe. I want you to consider one position here, and I'm sure we've all been in it before, and tell me what's wrong. Let's say a resident's on the floor and I have to bend over to pick them up, okay? And I'm like this, all right? Right now, we have our knee hyperextended. We have our lower back, which is not only receiving pull, but it's also twisting, all right? And then we end up with our shoulder potentially being strained. I'm more concerned about the back, but for those of us that are prone to knee injuries, like me, it just runs in the family, hyperextending the knee is a problem. And then we need to think about static positions. So there was a resident where I used to hold her leg up for an extended period of time while we did a wrap on her. That holding of the leg in a static position, the same position for the extended period of time, it made my back sore. I wasn't necessarily doing anything wrong, but it was the same position for so long. That's not good. We need to rotate. We need to make sure that we're utilizing as many people as we can for those difficult things. And then there is absolutely no reason that we wouldn't be using a transfer belt for our residents. We have a transfer belt. First of all, it should be on your body at all times, but also there should be a transfer belt in each resident's room. I just did an audit today and added a bunch more, but by all means, use those transfer belts. Don't go without one. Don't tell the resident to grab onto your neck. It's just not worth it. And then finally, we have a safe patient handling committee. And I really think that you guys should get involved. If you think that there's an issue going on at the care center that needs to be discussed, we meet the third Tuesday of every month at 2 p.m. If we need more equipment, if you see your teammates not handling people correctly, if teamwork is an issue, this is the kind of stuff that we want our leadership team to know. So please bring that forward. That I most certainly would appreciate. Finally,